One fruit that destroys blood pressure meds, high blood pressure, or hypertension, is often called the silent killer. Millions of people worldwide take medications every day to control it. But what if there was one simple fruit that could interfere with these powerful drugs? A fruit so potent, some doctors warn against eating it if you're on blood pressure meds. This isn't just a clickbait headline, it's a real and medically acknowledged issue. Let's dive in. The shocking truth behind a common fruit. Imagine this. You're trying to do everything right. You've cut back on salt, you walk daily, you take your prescribed blood pressure pills without fail. But your doctor notices something strange. Your blood pressure is dropping too low, dangerously low. What changed? You started eating grapefruit. Yes, grapefruit. The citrus fruit many people love for breakfast, or in juice form, has a dark side that few people know about. It can dramatically interfere with blood pressure medications. So much so that it can turn a safe dose into a dangerous one. Grapefruit versus. Your body's chemistry, here's how it works. Grapefruit contains compounds called furanocoumarins. These naturally occurring chemicals block a key enzyme in your small intestine called CYP3A4. Why does that matter? Because this enzyme is responsible for breaking down over 85 different drugs, including some of the most common blood pressure medications like amlodipine, nifedipine, losartan, statins. When you eat grapefruit, that enzyme gets blocked, and suddenly your medication stays in your system longer and stronger than intended. This can cause low blood pressure, dizziness, or fainting, irregular heartbeat, organ stress, serious interactions with other medications. In other words, you might be taking the same dose, but getting double or even triple the effect. Why doctors don't talk about it enough? You'd think something this serious would be printed on every medication label, right? And it often is. But how many of us read the fine print? Doctors might briefly mention food interactions, but rarely do they emphasize just how dangerous grapefruit can be, especially for people over 50, who are more likely to be on multiple medications at once. Plus, not every doctor checks what you're eating. If you switch from orange juice to grapefruit juice to be healthy, no one may even notice until symptoms appear. The real reason this fruit is so controversial, some conspiracy-minded folks say pharmaceutical companies want people to know about natural alternatives that interact with their drugs. But this isn't about replacing medication with fruit, it's about understanding how one fruit can make your meds turn against you. In fact, the FDA has issued warnings about grapefruit juice going back decades. Hospitals post signs in cardiac wards telling patients to avoid grapefruit. Yet in the general public, almost no one knows why. Because it sounds unbelievable that something so healthy, so natural, could actually cause harm. But grapefruit isn't just juice. It's a chemical bombshell when combined with the wrong meds. Grapefruit's cousins, other citrus fruits you should watch out for. You might be thinking, okay, I'll just avoid grapefruit. Problem solved. Not quite. Because grapefruit has a few cousins that can cause similar, though usually milder, effects. These include Seville, oranges, pomelos. These fruits also contain furanocoumarins and can interfere with the same liver and gut enzymes. While not as potent as grapefruit, they still pose a risk, especially if consumed regularly. The bottom line, if you're on blood pressure meds, it's not just grapefruit you need to worry about. It's the whole citrus family tree. Real-life cases. When grapefruit turned deadly. Let's look at what this means in real life. Case 1. The retired teacher, a 66-year-old woman in good health, was prescribed felodipine for her mild hypertension. She also started drinking fresh grapefruit juice every morning, thinking it would boost her immune system. 2 weeks later, she was rushed to the ER with severe dizziness, a fainting spell, and a dangerously low heart rate. The cause? Her blood pressure had dropped too low. Doctors traced the cause back to the grapefruit juice, which had amplified the effect of her medication threefold. Case 2. The jogger, a middle-aged man on amlodipine, drank grapefruit juice before his morning jog. Halfway through his usual route, he collapsed. Blood tests showed toxic levels of the medication in his bloodstream. He survived, but only after days in the hospital. The worst part? It stays in your system. Here's the kicker. Even if you eat grapefruit in the morning and take your medication at night, the interaction may still happen. Why? Because furanocoumarins from grapefruit linger in your digestive system for up to 72 hours. That's right, the effects last up to 3 days. This means even occasional grapefruit can affect your blood pressure treatment plan in unexpected ways. If you're thinking, well, maybe just a few slices won't matter, think again. Studies show that even half a grapefruit or 1 glass of juice can make a major difference. But wait, isn't grapefruit good for you? Yes, in many ways it is. Grapefruit is packed with vitamin C fiber, antioxidants like lycopene and naringinin. It's been linked to weight loss, better immunity, and improved heart health. If you're not on medication, that's the twist. This fruit isn't bad in itself, but in combination with certain drugs, it becomes a silent danger. Think of it like alcohol. It has benefits in small doses, but if you mix it with sleeping pills or antidepressants, it can be deadly. Same story with grapefruit and blood pressure meds. How to know if you're at risk, you may be wondering. How do I know if my medication is affected? Here's a checklist. Does your prescription mention avoiding grapefruit? Is your drug a calcium channel blocker? Do you take statins? Has your doctor ever warned you about food interactions? If you answered yes to any of these, or even if you unsure, the safest choice is to avoid grapefruit altogether unless cleared by a doctor or pharmacist. Why your body reacts so strongly? To really understand why grapefruit has such a dramatic effect, we need to look at how your body processes medications. Normally, when you take a pill, your digestive system breaks it down and sends it to the liver, where enzymes like CYP3A4 help deactivate part of the drug before it reaches your bloodstream. This is called first-pass metabolism, a natural protective mechanism that prevents too much medication from overwhelming your system. But grapefruit shuts down this enzyme in your gut wall. So instead of the usual controlled release, your body absorbs much more of the drug faster than intended. You go from a slow drip to a flood. The medication isn't stronger, it just stays in your system longer and at higher levels. Like someone turning up the volume too high on your speakers. Why this fruit hits older adults harder, this interaction is especially dangerous for older people. Here's why. 1. Slower metabolism. As we age, our liver and kidneys process substances more slowly. That means drugs and chemicals stay in our system longer, even without grapefruit. 2. Multiple medications. Most people over 60 are on at least 2 or 3 daily meds. The more drugs in your system, the higher the chance of interaction, even without grapefruit. 3. Weakened blood pressure regulation. Aging arteries don't respond as quickly to pressure changes. A sudden drop caused by an overdose of medication can lead to fainting, falling, or worse. 4. Harder to pinpoint the cause when an older adult experiences dizziness, fatigue, or confusion. People often blame age or dehydration. Grapefruit-induced interactions often go undiagnosed. In short, grapefruit doesn't care how young at heart you feel. If your body is slower to adapt, the effects hit harder and take longer to recover from. The hidden danger? Grapefruit in disguise. You might think, I don't even eat grapefruit. I'm safe. But think again. Grapefruit hides in more foods than you realize. Breakfast buffets at hotels. That citrus blend juice may include grapefruit, store-bought smoothies, or detox juices. Often have it for the zesty flavor, canned fruit cocktails. Check the label. Grapefruit segments are often added for tartness, marmalades, and jams. Seville orange is a cousin of grapefruit with similar effects. Most of these don't clearly label warning, may interfere with medications, which means you could be accidentally sabotaging your own treatment without realizing it. When healthy becomes harmful, we've been trained to believe that fruit is always healthy. And most of the time, that's true. But here's the uncomfortable truth. Natural doesn't always mean safe. Poison ivy is natural. So is a venomous snake. So are mushrooms that can shut down your liver. Grapefruit isn't deadly, but it is powerful. So powerful that scientists still study it for use in drug delivery systems. In some cases, researchers even try to harness grapefruit's blocking ability to make chemo drugs stay longer in cancer patients' systems. But for the average person, that same strength is too unpredictable. The same amount of grapefruit can have very different effects on two people depending on their age, weight, and genetics. Your body signals what to watch out for. If you've been eating grapefruit and are on blood pressure meds, your body may already be giving you early warning signs. These may include lightheadedness when standing up, unusual fatigue, cold hands and feet, blurry vision. These symptoms are often brushed off, but they can be your body's way of saying, something isn't right. If you're feeling off, don't wait. Look at your diet. Grapefruit may be the silent culprit. Food should heal, not interfere with healing. Sometimes, all it takes to stay safe is knowing exactly what's on your plate.